Hi, I'm Allyson Mullins, and I'm a clinical director at Cadient, and today we're going to be talking about toilet training. I became a BCBA in 2014, and I've worked in the field since 2011 with a variety of individuals. And most of those individuals I've potty trained, including adults. So now we're going to go through 3 different methodologies that are research-based ways of potty training. So the first very popular method is the Fox and Zirin Method. It's the RTT method. So you're going to take your child every 30 minutes for 8 hours a day. You're going to have them sit on the potty 10 to 20 minutes or until they void. If they don't void, then you're going to take them off the potty and put their clothes back on. But every 5 minutes, you're going to do a dry check. So you're going to have your child feel their underwear and provide praise and reinforcement when they stay dry. And if they're wet, they go to the potty, and you're going to have them sit for up to 4 different times. If your child initiates, then you're going to stop this 30-minute schedule, and you're going to continue to follow the procedures without the schedule. So you're going to continue those dry checks. After they are initiating reliably, so this says 20 consecutive sessions, you're going to generalize into the community. So something that's interesting is, instead of what you would think is have them go before they leave the house, you're actually going to push liquids and then go straight to the store and go straight into the bathroom and see if they initiate using the bathroom. And if not, you're going to prompt them to do that. So that way they are able to generalize and they have the motivation and need to go. Another popular method is the potty party or the weekend potty boot camp. This is the method that I've used for both of my girls, and I'll tell you a little bit about that after. So you're going to, as soon as a child gets up, you're going to sit them on the toilet, and they're going to sit there until they void successfully. And during that time that they're sitting, you can give them breakfast and push liquids and talk to them about using the potty, but you're going to keep them sitting. As soon as they go, you're going to provide huge reinforcement and praise, and you're going to write the time that they stayed on the toilet, and that's going to be your baseline. So you're going to allow them 5 minutes off the toilet, and then you're going to put them back on the toilet, and they're going to stay on the toilet until they either void or you reach baseline again. So if they reach baseline, you're going to take another 5-minute break and then put them back on the toilet until they go. But if they are successful, you're going to increase the time off the toilet by 5 minutes. So for each successful void, you're going to increase that time until you reach an hour, and they're on the hourly schedule. So for accidents, if they have an accident while they're off the toilet, you're going to decrease that time by 5 minutes. And the expectation is that you're going to do this all at home in a 3 or 4 day weekend, and that they will be trip trained before they are generalizing the skill in the community. So my oldest child was able to do this successfully in 3 days and had no problem generalizing this at her daycare. My youngest, it took her 6 days to master this successful, to get on that hourly schedule. She was staying dry off the toilet, but we could never reach the hour. But since she's been at daycare, she's been able to initiate going to the bathroom. So they were both successful in different ways, but it just goes to show that every kid is different, and we had to switch up reinforcers with my youngest. We had a basket full of fun treats, and we had to go to edible reinforcement because that was more reinforcing for her, and we saw more success with that. So don't be afraid to switch it up too if you're noticing that it's not working or it's not effective with your child. So the last approach is a research-based approach, and it's basically taking the best of both worlds of those two different strategies. So you're going to, prior to potty training, you're going to take baseline data on when the child is most likely to void. So you're not going to be pushing extra liquids, you're just going to go about your normal routine and do dry checks every 30 minutes. And you're going to get, over the course of the week, a pretty good understanding of when your child's most likely to go or how long they're staying dry. And you're going to do this in every setting. Then you're going to take your child on the schedule that based on that baseline data. Sorry. And then for this method, instead of trying to flood them and then have them go in the community as soon as you get to the store, you're going to schedule those breaks out of the house after a bathroom break. So you're going to wait until they successfully void on the toilet, and then you're going to go to the store so to prevent accidents. And then instead of having them sit for long periods of time, you're going to have them sit for up to 20 minutes or until they void. And just know that if they're having regular bowel movements, you may have to have them sit longer during that period of time that they usually go. And that's it.